What is blood pressure and effects?
Hi everyone. Welcome to MyDigiDoctor. I'm Dr. Lara. MyDigiDoctor is the fastest and easiest way to learn more about health subjects.
What is blood pressure and effects? When the heart pumps, blood pressure is a measurement of the force of blood against the arterial walls. The pressure is revealed as two numbers. The optimum blood pressure for a grown-up is 120/80. The first higher number, called the systolic pressure, determines the highest pressure put in when the heart pumps. The lower number, called the diastolic pressure, reveals the minimum pressure to the arteries when the heart rests in between beats. Blood pressure is determined with a cuff and stethoscope while the arm remains in a resting position. The cuff is positioned about 1 inch higher than the end of the elbow. It is pumped up to the reach 30 points higher than the individual's normal systolic pressure, or 210 if previous information is not readily available. A stethoscope is put on an artery within the elbow, then the air is gradually enabled to get away from the cuff. The point at which the noise of the pulse is first heard is the systolic pressure number. The point at which the sound vanishes is the diastolic number. Numerous aspects can impact blood pressure, so one high reading does not always indicate that an individual has high blood pressure or hypertension. Immediate stimuli such as worry, discomfort, anger, and some medications can momentarily raise an individual's blood pressure. If a high reading has taken place, and these aspects exist too, then the individual requires to be kept an eye on consistently over an amount of time to identify if this is a sustained condition, or if the reading was just based upon situations. High blood pressure is a leading reason for strokes, cardiovascular conditions, kidney, neurological and neurological conditions, and preeclampsia in pregnant females. The blood pressure is reading of 120/80 or lower is thought about healthy. An individual is thought about to have prehypertension if the systolic number varieties above 120 to 139, number varieties above 80 to 89. Systolic readings from 140 to 159 or diastolic readings from 90 to 99 are categorized as phase 1 high blood pressure. Systolic measurements of 160 or above or diastolic measurements of 100 or above suggest the extreme condition of phase 2 high blood pressure. The condition must be attended to if an individual has been identified to have high blood pressure. Some habit changes can be useful, such as consuming healthy, keeping correct weight, working out frequently, and restricting salt and alcohol intake. Sometimes these efforts are insufficient, and medication is suggested. Even if a person is taking drugs, some lifestyle changes will be helpful in managing the condition, and the changed habits might minimize the number of drugs needed to keep a healthy life. In some cases, individuals can have pressure readings that are lower than 90/60, which is what is thought about the bottom of the normal blood pressure ranges. This condition, called hypotension, might trigger absolutely nothing more than a sense of dizziness when moving quickly from a sitting to a standing position. Hypotension can be a sign of a hidden medical condition, such as heart failure, infection, severe diabetes, shock, gland conditions, or dehydration. Alcohol, antidepressant, and anti-anxiety medications, diuretics, pain relievers, and some other medications might likewise trigger hypotension. An individual's blood pressure can alter in time, so routine tracking is needed for the patients. Thanks for watching. Please don't forget to like, subscribe, and share. Help us to spread health to the world.